Okay, I'll share my screen here.
Recording in progress, everybody. This is Gabriela. She's going to present today about wearables and sport cardiology. She's a doctor, bilingual in English. We have teacher Julia. What's up, teacher?
Hi, what's up?
And you guys now are about to see Gabriela. Gabriela, you have alarm to 5 minutes.
Hi, here is Gabriela. So today we'll be talking about wearables and sports cardiology. And this is a field that is actually super increasing since technology is rapidly evolving. And we have been changing the way that we monitor and manage the heart. And especially with athletes, but also with amateur athletes and also people that are only fitness engaged and like to be health and take care of their health. So the goal that we have when we use wearables in sports cardiology is to not only enhance performance by the way we monitor and we can see a lot of cardiovascular data, but also to ensure safety while people are doing the exercises and practicing sports. So wearables are becoming like a key tool in the way that we monitor and that we can diagnose things earlier and maybe help people to get even better with their performances. But how did we get here? So we have like in a rising of direct to consumer health related wearables devices. But the thing actually started during the 1700s when the first pedometer, that was a device that was able to count steps, count people's steps, actually was developed by scientists. But we actually spent like more than 2 centuries with not that many technologies in this field being evolved. And in 1940s, the first oximetry that was developed by science during World War II so that we could monitor pilots that were working on a war. But the real game changer in this field of wearables and in cardiovascular monitoring was on 1960s where micro electromechanical systems, that are also called MEMS, were able to sort of miniaturize this kind of technology that can monitor people in a way that we can use them on small devices that people actually use on their daily basis. So in a way that we can use those things in a populational, in a like you know, with a lot of people in a populational way. But the thing actually became more like a hit more recently. So in 2006, Nike and Apple actually did like a partnership, and they launched Fitbit. That was a fitness tracking system. They used both Apple at the time iPads and Nike uh, sneakers in a way that people could start monitoring their steps. In 2012, the first single lead EKG, that is the electrocardiogram, was developed in a way that we can actually do and provide an EKG only with like smartwatches and not a lot of leads in the way that we do in hospitals. And the major hit that was the Apple Watch in 2015. That's something that a lot of people have nowadays, that is able to do single lead EKGs, can monitor your heart rate, your heart rate variability, can monitor arrhythmias, and can help also clinicians and cardiologists to diagnose things earlier in a way that we have actually articles that study specifically the way that Apple Watch can diagnose some sort of arrhythmias that are cardiology interested, like atrial fibrillation, for example. And now, not only have Apple Watch, but we also have smart rings, earrings, and necklace, and eyewear, and even clothing that is able to monitor our patients regarding cardiovascular parameters. So basically, those wearables are revolutionizing sports cardiology. The main goal is to enhance performance in and while ensuring safety, like I said earlier, like avoiding that our patient is having an arrhythmia or exposed to some sort of cardiovascular problem during the time that he or she is exercising. So we are able to continually monitor the heart of athletes, and not only during the time that he is on a consultation or performing an exam, that we'll see him during like minutes or hours only. So we can watch our patients and take care and monitor during a lifetime. So here's the example of the ring, the monitor ring. And the importance here is that when you think about the US, 20% of people own a health tracking device. So this is the potential use of this technology in terms of cardiovascular health. And you can only imagine how many cardiovascular parameters we could document, even a populational scenario, like thinking about public health and things that can be done to the whole population. And a few of the potential uses of the wearable device is to assess paroxysmal symptoms. For example, sometimes those symptoms are not performed during the consultation or during an exam that will only watch patient during a few hours. To screen palpitations and cardiac arrhythmias, to diagnose causes of dyspnea, that is the short of breathing, and chest pain, and also regarding like health patients, to help them during physical training and wellness support. So the wearables will give a real-time heart rate and rhythm tracking, a continuous monitoring during training and competition, so in like real-time, real-life experiences. And they can track your heart rate variability, fitness assessment. That is a parameter that can help us even on diagnosing overtraining on athletes. That is a major cause of sometimes reducing their performance during competition. So wearables are able to detect arrhythmias, like I said earlier, especially atrial fibrillation. That is arrhythmia that is really associated with stroke, can help us detection earlier and prevent severe cardiac events like sudden cardiac death, and has an importance for athletes, professionals or amateurs under physical stress. We can use those parameters to improve our cardiovascular adaptations and the things that we tell our patients to do, and we can prevent overtraining and related heart complications by monitoring them more straightly. Of course, a few of the limitations of those kind of technologies, that accuracy can vary by the brand or the technology that is involved on the sort of the device. If the person is doing a high intensity exercise, sometimes it can loses a few of the accuracy because of poor sensor contact with the patient's skin. Wearables are a complement, not a replacement for clinical evaluation. So it's always important that if your wearable finds an alteration or an arrhythmia, that your clinician or your cardiology has to look for this lead, for this EKG, to see if it's actually an arrhythmia, or maybe it was a poor sensor contact that actually made a false positive arrhythmia. And of course, we need to properly interpret the data that the wearable gives us. The future directions that we have a possibility of advancements on this monitoring with continuous EKG, maybe monitoring oxygen saturation. That is something that is not available nowadays. We can use AI to get all this data and do models to predict heart health, and even using machine learning devices. And by this way, you can personalize and prevent cardiology events and even sudden cardiac death. So basically, wearables empower athletes and clinicians because it helps us to better monitor them. It can help us on early detection of arrhythmias and personalized insights on each patient. But of course, limitations exist, but the potential is significant, and I think it's something that will only get more disseminated since people are only having more access to technology. I think this is it. Stop sharing.
Awesome. Let me count here. That was
I
five.
don't.
That was the 5 minutes plus 2 minutes plus 3 minutes. So that
Oh
was
my God.
10 minutes. 10 minutes. It was only 10 minutes. Well, it is still
Almost there.
recording. Juliana has some questions now, answering some questions about the presentation. It is not presenting. So I want to see how you answer those questions. So, Ju, whenever you want, please.
Okay, so let me just start right here. How can wearable devices help prevent heart problems in people like who regularly practice sports? And you mentioned that there are the regulations itself, but what specific indicators should we monitor to avoid complications during exercise?
I think the main parameter that we should look at during exercise is basically the EKG or the arrhythmia alarms that most of those devices they have, because it's pretty common to have symptoms during exercise, and of course symptoms during exercise, there are something that actually makes us really worried about, especially because they can be some sort of malignant arrhythmia that sometimes the wearables can detect, like ventricular tachycardia or atrial fibrillation. And sometimes if the wearable detects like one premature beat that there is ventricular, or lots of premature beats that are basically a precursor of and sustain arrhythmia, we can prevent and detect that maybe you are at risk of developing one of those malignant arrhythmias, and we can prevent and treat and give you medication, prescribe you medication that will prevent from having an event that sometimes can lead to sudden cardiac death. And also with people that sometimes they present like chest pain during exercise, that's maybe a sign of myocardial infarction. Sometimes like one lead EKG can detect alterations on your EKG that are associated, are related to myocardial infarction and ischemia, and they also can tell you like give you an alert that maybe you should go to
Some
the
warnings,
emergency.
yes.
Yes, exactly, some warnings. I think
Oh,
basically it is, and of course that we have a few of especially genetic disease that sometimes won't present like on another way than arrhythmias and things that sometimes, even despite the fact that we have exams and Holters, we have some sorts of monitorations. Those monitorations are not continuously. So sometimes you do those exams in a patient, but the patient does not have the symptom by the time he's actually being monitored by the exam. So having the wearable and wearing the wearable makes us having a way more time to monitor those patients and maybe find one, especially I would say arrhythmias. I think it's the main thing, the main area where we use wearables.
oh, yes. Well, one more in this case. To what extent can wearables replace or complement traditional cardiology consultation? You mentioned, of course, that it's warnings or something like that, especially for individuals with a history of heart problems. It is
Yeah.
only for themselves, like I have this warning, or there are other people who are concerned about it.
Yeah, I think even asymptomatic patients, they can how do I say? They can benefit from the wearable, from this monitorization, especially on those heart variability rates, because can detect overtraining and sometimes some diagnoses that are specific to athletes and to people that are like way too engaged with fitness. But regarding like disease, really like disease, it depends on like age, on the chances that you might have a heart disease. So for example, if uh, an old guy like 70 something years old that has already had myocardial infarction and has symptoms of palpitations, has an alert and a warning from this smartwatch that he has an atrial fibrillation, this is something that I'll be like almost certain that it's actually accurate and it's actually a real atrial fibrillation. But if, for example, you don't feel palpitations at all and you're not feeling anything and your wearable says that, oh, your beat is a little bit irregular, so maybe you have an atrial fibrillation. Maybe the smartwatch isn't right and your cardiology has to look at this tracing that you can actually have it from your smartphone and see, oh no, he's actually misdiagnosing. It's just like a normal variation of the rate, and you are under the normal beat, the sinusal rhythm, like this, that it is the normal rhythm of the heart, and it is
Okay.
wrong. But when you talk about in terms of like sensitivity and specificity to diagnose arrhythmias, the newest smartwatches, they come to like 90, 80, and 90% of sensitivity and specificity. Sensitivity is basically the ability of a test to find the real positives. And the specificity is
90% of accuracy.
yeah, of course, this depends on the prevalence of the disease and the population that I'm studying. So, of course, like I said, the chance of an atrial fibrillation in a young person, a symptomatic person, actually be right is lower than in someone that has like major chances of having atrial fibrillation. This is sort of like statistical stuff, but it's
Okay.
actually pretty 80 and 90% is pretty accurate. I don't think it replaces at all, because even when you even if the wearable is right, you still have to go to your clinician, to your cardiologist, to actually, oh, now you have a diagnosis, so let's confirm it, let's start a treatment, let's see if it has any repercussion repercussion falei, repercussion on your heart. But I think we can interpret it and see as another tool to monitor and to diagnose things. Like we have tons of other exams. Like we have Holter, we have loop monitoring. So we have now wearables, especially to detect arrhythmias. I think this is the main area.
Yeah, and it is so important. Darling, I really liked the topic that you showed because we use on our we wear on the wrist, we use it on the cell phone, we are surrounded by it. So it's a really interesting theme. It's a really interesting area that you work on. I'm really impressed with your English. It's a clear English. Congratulations on it. It's really good. It seems like I'm hearing a TED Talk that Johnny's used it to watch. So it's amazing. Congratulations on your English. You've been doing really great on it. And thank you so much for your presentation
Oh,
to
thank you for
show
watching.
to show me all the things. And for me, this is it.
Let
I
me
don't
let
have
me
any questions.
only
I
add
don't have any point.
some things regarding pronunciation and grammar. We see diagnosing. Remember about nose, so diagnosing.
Mhm.
Something
Diagnosing,
that's like brand
diagnose.
new, say newest, newest. not
Newest.
not newest, like pelado,
Newest.
yeah. The chances, okay, we could say the chances of being right or the chances to be right, but never without just with the be. You said chances uh be right. You got to say of be
Okay,
or to be right.
to be.
And the hypercurt here, I searched it here. GPT said that have an impact.
Have an impact.
Juliana,
Okay.
stays there. I want to show everybody, you too, what I've done while you girls were talking. I asked ChatGPT to analyze the presentation itself, not what you were saying, because I got to do this after the presentation. So here your presentation. So did you write all these words here? It was you? Was it you?
Yeah,
Awesome. So we have
yeah.
your vocabulary here, the way that you separated it, and as I sent everything to ChatGPT, I asked it in an opinion, a summary of and a feedback of your presentation. Do you want to hear it? So let's hear it.
Got it. Now that you've shared all the slides, here's a summary and my feedback on Dr. Gabriela's presentation. Summary and feedback. Strengths of the presentation. 1. Content organization. The presentation is well structured, covering key aspects of wearables and sports cardiology, from history and timeline to potential uses, limitations, and future directions. This logical flow makes it easy to follow. 2. Visual simplicity. The slides are clean and visually focused, which helps to keep attention on the spoken content. The use of simple slides with key points allows Dr. Gabriela to expand upon them during her spoken delivery without overwhelming the audience. 3. Balanced topics. The presentation touches on essential topics like real-time monitoring, early detection of cardiac issues, limitations of wearables, and how they empower athletes and clinicians. These are all relevant and important for the audience to understand. Areas for improvement. 1. Depth of information. While the slides serve as great visual aids, they are quite simple, and the real depth of the presentation relies heavily on Dr. Gabriela's spoken words. If she wants to leave a more lasting impact, adding a bit more information to certain slides, such as the future directions or potential uses, could help support her verbal points more strongly. 2. Engagement. Since the slides are minimalist, it's crucial that Dr. Gabriela engages with the audience actively to maintain interest. Her spoken content must bring the material to life, especially since the slides don't contain much text. Encouraging audience questions or including short anecdotes could add to the engagement factor. 3. Confidence in delivery. Since Dr. Gabriela's first presentation wasn't heavily prepared, it's important she delivers this one confidently, despite its simplicity. Practicing her delivery, especially the transitions between slides, will help ensure she feels more in control and natural during the recording. Final thoughts. This presentation has great potential, and with Dr. Gabriela expanding verbally on each slide, it can be very informative. However, to elevate the presentation further, she could focus on making her delivery more dynamic and ensuring that the audience leaves with not just an understanding of the topic, but a lasting impression of its importance.
Oh, I liked this one. The lasting
Let me know
impression
if you'd
of
like
the
any more
importance.
specific feedback.
That's it. And just showing how fast we can like give you feedback about your presentation, everything 2 days. And now I'm going to finish this video. Say bye, everybody. See you, everybody. Bye. Join for